All right. Good afternoon, everyone. Want to welcome each of our panelists and everyone who's tuning in from home or their respective home offices. On behalf of the firm and my partners, I want to thank you for your support and interest in the webinar that we've prepared for you all today. And so thanks for tuning in. My name is Rubin Pusha. I'm a partner in the healthcare group, focusing primarily on health transactions and based in our Chicago office. And so I will be moderating the discussion for today. Our firm, for those of you who don't know, McGuireWoods is a full-service law firm providing legal and public affairs solutions to companies, both for-profit and nonprofit, across the globe. We have 1,100 lawyers in approximately 21 offices across the U.S., Europe, and Asia. Our healthcare team has well over 60 industry-focused lawyers who are advising clients daily on issues spanning the legal spectrum. I want to introduce you to each of our panelists now. First on our list is Siobhan Bautista. And I'll give her a moment here to introduce herself and let you all know what she does and how she ended up in healthcare.
Thanks, Rubin. I appreciate it and very excited to be here today. My name is Siobhan Bautista. I'm the general counsel for North Shore Edward Elmhurst Health, which is a 9-hospital integrated health system in the Chicagoland area. I ended up in healthcare by a little bit of a segue through other industry. I actually worked as outside counsel to North Shore for many years before going in-house at United Airlines. And then when this opportunity came up, was excited to come on board in-house at North Shore. And then, of course, over the last few years, as we've all experienced COVID, healthcare took on a different life. And so I've certainly enjoyed and committed myself, I think, to healthcare going forward. Once you're in, I don't know if you can leave after a COVID experience. But no, it's been great, and I look forward to participating. Thank you for having me.
Thank you, Siobhan. Next, our next panelist is Elmore Patterson. Mr. Patterson, if you wouldn't mind introducing yourself and telling us a little bit about how you ended up in healthcare.
Good afternoon. I'm Elmore. Working at Kansas Hospital. I've been in healthcare for 23 years. Started off in healthcare in the United States Army as an Army officer in Medical Service Corps. So I've been able to see different transitions of healthcare from government healthcare to regional healthcare in rural communities. I'm very excited about where we're going at in healthcare. Very encouraged about how we handle COVID-19 and how we're looking at different models to get better at what we do. One worth mentioning is telemedicine. And I'm excited about the conversation that we're going to have today in reference to healthcare. So thank you, Rubin, for giving me the opportunity to be here. Really appreciate it.
All right, thank you. And last but certainly not least, Dave Morlock.
Thanks, Rubin. Dave Morlock, Managing Director at Cain Brothers. I run the health system M&A practice for the firm. Cain Brothers is a boutique investment bank that's been around for 40 years. We only do healthcare, both for-profit and not-for-profit healthcare transactions in hospitals, health systems, managed care, physician groups, as well as in the private equity space and all manner of verticals that private equity touches. Prior to my time at Cain Brothers, I was the CEO at the University of Toledo Medical Center, and before that, CFO at the University of Michigan Health System. So I've had opportunities to sort of be on the not-for-profit C-suite side as well as in the investment banking space. And how I got into healthcare was 32 years ago. I would love to say that it was an altruistic streak, Rubin, that led me in that direction. That would be a total lie. I just looked at it and said, wow, that industry looks like it's got a great growth demand curve. Maybe if I took my career that way, it would be, good for my career as well as the growth of the industry. And how apropos that we're talking about growth strategies now. So.
Perfect. Thank you. Thank each of you again for donating your time and participating in this discussion. And Dave, what an excellent segue into reminding our audience of the topic for our discussion today, which is health system growth strategies. And so we're going to spend the next 30 or 40 minutes here talking through what we think about when we think about growth for health systems, some of the strategies that each of these individuals have been involved in developing, and then some of the challenges and issues they've seen in deploying some of the growth strategies that they've come up with in concert with both legal and executives at their respective organizations. And so to jump right in, the first question, and I'll tee this up for Elmore, is how do you define growth? What do you think about when you think about growth for your organization?
Definitely, the defining growth is looking at services, how many services we can provide inside the community, and how much of that catchment area that we're able to provide care to. And then looking at how much of the possibilities outside of our catchment area that we can provide services to those individuals who reside in those areas, either it's outside your county or outside your state. As we grow with our footprint and looking at services that we render inside the health systems that I work for, we always look at how can we bring specialty and other care into those communities so we can expand and increase our primary care footprint and our brand within those communities. So as we grow, we look at the different services that we'll be able to render, and then on top of that, what human resources we can put on top of that matches our budget.
Thanks, Omar. And Siobhan, I think I'd love to have you weigh in here too. And I think you offer a little bit of a different perspective as you are in the middle of growing a legal department. And so it'd be great to hear how you view growth. Certainly, I'm sure you share some of the thoughts of Elmore, but it'd be great to see what the intersection is between the growth of your own department and the larger health system.
Sure, happy to speak to that. So I'd say growth for our organization has been about traditional growth in terms of size and a lot of what Elmore just described, but I think also how do you stay relevant? So looking at growth from a strategic perspective, are we not just getting bigger, but are what we're doing relevant to what the needs of our community members and patients and employees, team members are today? So to your point, Rubin, we've grown over the last 3 years with 3 significant transactions, acquiring 2 hospitals and then merging with another health system in our area this past year as of January 1. So as part of that, we have integrated a bunch of our corporate services, or on the path to integrating a lot of those corporate services, including the legal department. North Shore traditionally did not have in-house counsel at all, and so part of that onboarding for myself and my role has been to grow an in-house team, and then obviously over the last 3 transactions, integrate those coming from other hospital systems and finding the right footing, both in terms of scale, but I think really to be a resource to our business partners, our strategic thought partners, and our C-suite. So it's been a great path. I think we've been pretty successful, both from a retainment standpoint, or retention standpoint, as well as finding the right balance of engaging with our strategic partners and our business leaders and our operation leaders to define how we can support them. I'm not sure if other lawyers on our audience are familiar with the legal is no, but we try to change that culture so that folks are engaging us early and we're not the last stop on the train, especially because there's been so many growth and so many different decision makers right now. So I think integrating the legal team, not just inside of our legal, but across the entire system to make sure everybody is having consistent processes, knowing who to reach out to, and that we're staying ahead of them so that we don't become the last stop on their train.
Thank you. And Dave, I'll give you a few minutes to weigh in here too. I think you offer a fairly unique perspective, having sat in the top seat in a health system organization, but now being on the investment banking side. Where does your mind go when you start thinking about growth?
Well, actually, Siobhan gave a great segue into where my mind goes. What we like to tell our clients is that you need to be a relevant player in a relevant market. And so that means different things depending on where you are located. In some of our markets around the country, you may be the only provider in the county, or in even a couple of counties over. And in that instance, growth can mean something quite different than if you are in a major metropolitan area where you are competing with other health systems, or even more interestingly, very large either private equity-backed or insurance company-backed physician roll-ups who are positioning themselves as, in some respects, health systems without the burden of actually owning the brick and mortar and the hospitals. So growth can mean, in some instances, growth in patient activity and admissions and OR cases and clinic visits and things like that. In other markets, I think growth means the accumulation, I'm not sure I can think of a better word off the top of my head, but the accumulation of attributed lives or covered lives where you are integrating the insurance risk along with the provision of care through physicians and through the hospitals and that kind of thing. So growth can mean different things in different markets. And then it also matters whether you are in a market that happens to be growing as opposed to a market that's not growing very fast. If you're in Dallas, for example, and you're adding 1 million new residents in the Metroplex every decade, growth is a different discussion than if you are in Detroit, where the size of the population is not growing at all, like the way it is in Dallas. So there's a lot of factors that play into how you might define growth, and it sort of has to fit into the context in which you're working at that moment.
Thank you, Dave, and certainly from all three of you, I see some common themes when we think about growth, and understanding we're all in the business of healthcare, that service to the patients is at the core of what we do and when we think about growth. So moving the discussion along, I know that each of you have had opportunities to sit at the table when growth strategy is being developed, and may have even been asked yourself, like, what's that next thing for us as an organization? And it'd be good to just hear from you, and we'll start with Siobhan. What's the first thing you think of? What's the first question you ask yourself when your CEO says, "Hey, what's our next growth strategy? I want to hear from you. I want you to help me develop where we take the organization next."
Sure. So I think, and this has happened a few times in recent history, just having been through some significant transactions. So I would say, first, understanding the goals, right? From a strategic standpoint, are there certain gating issues we want to understand up front, whether it be a timeline, either on our side or on the other party's side, if we're looking to kind of stick to a certain goal that they have. Antitrust concerns always come to front of mind. You can't be the lawyer at the table without thinking about, what are we dealing with from a regulatory perspective, and then sort of, ultimately where are we in this transaction? Are we in the driver's seat? Are we the receiving end? But what's our role to the overall strategy and plan? I would say those are some of my initial questions that come up. And then I think you quickly move to sort of mapping out that strategic road plan, making sure you have the right stakeholders. I think many of us can work closely with a CEO, but I generally advise that we will be more successful if we're bringing the right stakeholders to the table, as any growth strategy involves more than just a business perspective, especially when you get to integration planning. So we try and bring other stakeholders to the table sooner than later. But those are some of the initial conversations we have when we're planning out a new growth strategy.
Thank you. Elmer, what do you think? What's the first question you ask yourself when you're thinking about the overall growth strategy for the buildings that you're responsible for?
I think Siobhan is correct. Really looking at the stakeholders and having those conversations early. Looking at your footprint and seeing exactly what can we do and how can we be the appropriate way of getting things done. When you do look at growth, you have to be appropriate how you handle resources and being good steward of funds. So what I really look at is definitely looking at patient care, speaking to the stakeholders that's there, and seeing these services that can actually be rendered to better serve our communities. Because I'm in rural healthcare, communities come first. And when we think about those stakeholders, you're talking about board members, county commissioners, as external, even business owners inside those communities, and then looking at our internal as our department heads and our staff. And exactly, is it possible for us to get this done? So we do look at pro formas, we do look at business plans and trying to set things into motion that's really going to help out this community and get them stronger and provide them better health care. But when we look strategically, we really try to focus on what that community really needs and how can we better serve our community. Do health needs assessments, do strategic planning, to town hall meetings. How can we work together in partnership and build that bridge and that communication between the healthcare hospitals that I manage and the communities that we serve, and get stronger as a community on the health care perspective. And that's what we really try to do.
Thank you. Dave, I'm gonna pivot just a little bit, because I think that this is something that you probably spend a lot of time looking at. But what are some of the trends you're seeing in North America that are really driving the ways in which you're seeing health systems and organizations try to grow?
Yeah, thanks, Rubin. I think there's, a handful of things that we're seeing that are creating sort of the imperative to growth. The growth of Medicare Advantage, both in terms of just the penetration rate of Medicare Advantage versus traditional Medicare, and then the growth rate itself across the country and sort of on a state-by-state and market-by-market approach. I think Medicare Advantage ultimately will be the vehicle, or one of the prime vehicles, that pull us more quickly into value-based care than we've been moving for the last several years. We've been talking about population health and value-based care for, I don't know, Siobhan, how long? Like 12 years, it seems like, right? And it's been a sort of a slow slog along the way, if you will. But I think that growth and penetration of Medicare Advantage is a version or a trend that will accelerate the move to value-based care. I think another trend we see quite often over the course of the last couple of years is, as it relates to growth, is trends towards joint venture activities. This tends to be bigger health systems that we see, but that will do things like they'll have a home health and hospice business, for example, or an urgent care business, where they are not they're not running the business as robustly as, say, some of the national operators in those verticals run those businesses. So we are seeing health systems sell stakes of their ancillary businesses into joint ventures that are then managed and run by experts in those particular verticals: home health and hospice, urgent care, ASC, that kind of thing. Sometimes those are private equity-backed companies. Sometimes they're publicly traded companies. Occasionally they're not-for-profit companies as well. But, we see that trend for sure. All of that ultimately starts to speak to scale, consolidation, and frankly, regionalization. That is a trend that we are seeing. Like I said earlier, I've been in healthcare for 32 years. I've heard, I don't know how many times, healthcare is local. I would actually say the business of healthcare is no longer local. It is regional. The regions are getting bigger. And I think eventually we will see even some national systems coming together and emerging. I've heard some folks say the day will come where we only have 10 health systems in America. I'll be honest with you, I don't buy that. I think that's a bit of a provocative statement just to get people into a conversation. But I do see significantly greater consolidation where we're going to have secular not-for-profit systems who have significant footprints across the country. You know, there was a recent transaction where a major system in Chicago and a major system in Charlotte, North Carolina announced their merger. Somebody said to me, gee, we ought to think about all of the systems between Charlotte and Chicago because they might be joining those guys. And I look at it and I don't think that's the case at all. I think they're probably going to go across the southern border and talk to folks in Atlanta, Dallas, and Phoenix rather than, you know, fill in the gap and then ultimately create sort of a national system that is a secular, not-for-profit version of somebody like HCA. Those are some of the trends I'm seeing that are impacting thinking around growth.
Sure. Thanks, Dave. And Elmore, I know your career, at least in recent years, has been particularly focused on providing healthcare in rural areas. What are some of the trends that you're seeing that are impacting the way in which you think about growth?
Dave is absolutely right. As we leverage the resources and take on the risk at system level, we start looking at how can we better communicate well with our rural partners and then do acquisitions to bring on some of those resources to those areas. As I've been working in the rural healthcare, that's been the growing trend. The growing trend is how can we deal with mergers? How can we come together and take on some of that risk if it's value-based purchasing or value-based care? And definitely looking at other resources that could be attractive to rural areas where we would have never been able to receive that type of care or those type of equipment in because we just do not have the margins to be able to get that done. So as we move forward into the healthcare in the next 5 to 10 years, I think that we're going to see some more conversations being had under mergers or assisting small communities with their health system, even through management agreements or with complete managing the operation because of the risk that's associated with the Medicare Advantage, and then looking at value-based care and then trying to get the right services there at the right time without looking at how many patients that you actually see, but we're really talking about how well is the care being delivered in these type of practices, in these type of markets, which will improve patient lives. And with that being said, the opportunity will be less to try to be inpatient stays, but more into keeping the population healthier. And I think that's what value-based care kind of presents, the holistic approach. So as we move forward, we are going to see, I think, that we are going to see some new relationships be established and some new type of agreements being established around how can we better serve more of the population, not just in the urban areas, but actually looking at our rural counterparts and getting them involved with some of the great techniques and some of the great services that are being provided 1 hour or hour and a half away from their community.
Thank you for that, Elmore. Siobhan, you've already talked just a little bit about, at least through acquisition, some of the more traditional growth strategies or obvious growth strategies that your system has employed over the last couple of years, and you've also talked a bit about the legal department. Are there other growth strategies that you guys have deployed in the last 3 to 5 years that some of our listeners might be interested in, and that are some of the less obvious types of growth?
Yeah, I think Dave may have worked with you behind the scenes to tee that up because McGuireWoods actually just helped us with our home health and hospice JV that we got across the finish line late winter, early spring this year. So yeah, absolutely. I think, for a health system that I'm privileged to say has been traditionally well-resourced, there has been an interest and focus to do everything. And I think the national trend, exactly as Dave and Elmore are describing, has shifted over time to work with more strategic partners in non-traditional acquisitions or non-traditional transactions. And we've absolutely seen a shift to more JV type arrangements, home health hospice, pediatric services for us, and a few other areas to use as examples. So that's certainly been one. Population health, management and all the different strategies there, I think growth is just an obvious denominator that's needed to be successful. And there's probably no real cap when you say you're big enough to do it well, but I'll just kind of string that along to data in general. I think we're just moving to a more data-driven healthcare system. And so every time we're at a table with a strategic partner or a potential transaction, we have a lot of data at North Shore, and that's almost an asset when we're going to other partners. And it seems like if you want to do any type of data analytics, research, population health management, talking about how we can use data and bring data together across the system seems to be more and more of a common discussion point in those strategic conversations.
And Dave, I know you've, last 6 years at Kane, and then previously in CEO, CFO roles at two different university-related health systems. How have you seen the shift in the growth strategy conversation from the time where you were an executive to this point now? Sort of, I'll call it post-COVID, but the emergence from the COVID-19 pandemic. What are some of the differences that you see in the development of growth strategies, or even just the focus on growth?
So, 10 years ago, it felt to me like there was a lot of focus on things like physician recruiting and brick and mortar investment in ambulatory care settings, right? Building new clinic buildings, building ASCs, et cetera. But the health system's going to own and operate and run all of that, and the recruiting of the physicians, et cetera. Over the last couple of years, it feels to me like there has been more shift towards acquisition, merger and acquisition activity, big health systems coming together. It's a lot faster way to grow, to get yourself from, to double your revenue base by merging with somebody than it is to, incrementally grow it either through very small acquisitions or through, build and recruit strategies. Another place that we're seeing some interesting growth over the last couple of years that we hadn't seen quite as much before, and this is generally focused in the larger health systems, but we are seeing them create what amount to their own version of venture capital funds, or in some respects, even some of them that operate a little closer to like private equity, almost, not exactly like private equity, but almost, where they are setting up dollars and investing in businesses to create alternate revenue streams for the health systems. And then occasionally some of those businesses, then the health system will then pivot, recapitalize, take a big check in a private equity transaction, and that creates, resources that are very different than the traditional, hey, I'm going to go out and borrow 30-year tax-exempt bonds in order to go raise capital. So that's some of the differences we've seen over the last couple of years, I think.
All right. Thank you, Dave. And Elmore, this next one's for you, and certainly Dave and Siobhan, feel free to chime in if you have additional thoughts. But the COVID-19 pandemic saw this explosion of telehealth, and maybe not even a refocus, but an increased focus on sort of digital advancements in technology. I'd love to hear, Elmore, especially coming from the rural the rural hospital sector. How has telehealth changed your view on expanding your geographic footprint? Right. I mean, you've now shifted from really thinking very locally how to expand to maybe within your county or to the surrounding counties, to having the ability to bring on a service where you could potentially reach people on the outskirts of an urban area, or even think more broadly. And so I'd love to hear just generally how your system has been impacted by the explosion of telehealth.
Yeah, Rubin, that's a good question. Definitely, first thing you talk about is discussion is growth. But definitely access to healthcare. Open that door in the community using telemedicine has been tremendous for the rural healthcare provider that we serve. Definitely looking at our communities and getting them the care they need at home has reduced a lot of the risk and the missed opportunities of missing appointments because of transportation issues or because of the fear of coming into the hospital because of COVID-19 and things associated with it. We've been very blessed. We've had the opportunity to have telemedicine and speak to our region and our health system in reference to providers being able to have appointments with our community right there and be an hour and a half away. And with that being said, we increased the specialty services because of telemedicine. And we were able to even cover some of the mental health through telemedicine, which is very important inside our community, is trying to battle the mental health and see ways how we could be better at servicing our community through the mental health piece. So we were able to take on some of that risk. We was able to leverage that because there's a cost associated with it as well. Looking at how to set up the telecommunication and being able to have those services there. But we've been able to do some things on your phone and having some virtual visits on your telephone. We've been able to have some visits within the primary care piece. And in addition, we've been able to provide some specialty clinic services using telemedicine. So we have taken the bull by its horns, and we've been able to implement telemedicine at every step of our services that we provide, even having telenursing within our emergency room. So actually having nurses in Kansas City, Missouri, or somewhere else in the nation, and actually being down in our rural health emergency room and being able to see some things, because as you know, during COVID-19, the pandemic, we've had some real shortages in nursing services. So that was able for us to keep our doors open and keep our beds available because we was able to use some of the telemedicine services just for everyday nursing services within our hospital. So we're very proud of that. So I would say, yes, telemedicine has saved a lot of lives and has been able to get people to healthcare when they needed it immediately during the pandemic and moving forward into the future, because it's only going to get better, it's only going to get bigger, and we're very excited about what we have done with partnerships, leveraging telemedicine.
Thanks, Elmore. And Siobhan, I know as the explosion of telemedicine and telehealth was happening, that your mind was twofold. It was, your business hat was like, oh, wait, this is great, and we can serve more patients. But then I know your legal spidey senses were just going off. If you wouldn't mind just talking a little bit about some of the obstacles that you had to work through as a general counsel to help your business team fully deploy telehealth during the pandemic and going forward.
Yeah, absolutely. And you're right. I'm not always the most popular person at the table for this discussion, but we've been really successful in putting some telehealth guidelines and best practices together for the system. So I'd highly encourage others to sort of work with their providers on what is it we're trying to achieve. I think Elmore's example of mental health services is a great one and sort of a no-brainer. I think the more people we can bring mental health services, behavioral health services through telehealth, let's do it, let's get it wherever we can. But there are a whole other areas of clinical services that you need a stopgap for, that if you go too quickly with telehealth and you don't have the when this, come in for a visit, when that, go to your ED, right? It's sort of, as everyone is out pushing telehealth services, do we as the health system providers that have those other brick and mortar resources need to be careful we're not moving too fast and getting ahead of ourselves when traditional healthcare is still needed. Also, as an Illinois-based health system, I've had a lot of struggle on the outside of Illinois. This is where telehealth is growing faster than our regulators, and telehealth is defined differently in every state. Everybody has a few different rules about licensure and crossing state lines, where the patient is, where the provider is. And so it's been very difficult when a provider or a medical group says, give me one answer, and it's sort of like, no, I have to give you 50. So we've hit middle ground on that, and we've tried to develop some guidelines on here's what you can do, here's where you need to stop and get some, process in place, and here's when it's an absolute no. So kind of your green light, yellow, red light practices. And overall, it's been good, but absolutely trying to stay relevant again, and trying to stay ahead of it. I think you asked a little bit, not just telehealth, but other AI. We're in a major staffing crisis, as all of my colleagues and audience members probably are seeing. So to the extent we're starting to deploy and look at other tactics from, inpatient sitters that don't need to be a human sitting there anymore, and things of that nature that I really think we need to keep our eye on and moving forward as this industry is evolving and responding to a staffing shortage.
Thank you. And Dave, I see you shaking your head. I'd love to hear your thoughts on this as well and how it's impacted your work.
Well, look, I agree with what both Elmore and Siobhan have said. I think that the delivery of care at distance, whether it is telehealth, whether it is remote monitoring at smaller hospitals done at larger urban hospitals where expertise may exist that doesn't exist in the more rural communities, or whether it's pushing all the way to the infrastructure where acute care, to the extent possible, is delivered in the home setting rather than in the inpatient hospital setting. Those are all trends that we're seeing going on in healthcare, and I think they're only going to continue. We have one client who has completely jumped in full, both feet into both value-based care and the notion that home is the default setting of care, right? That is the first place. That's where acute care is delivered, in the home. Now, as we all know, not every home is equipped in order to permit that to happen for various social determinants of health, et cetera. And I don't think we're going to be like cracking chests and doing open heart surgery on the dining room table anytime in the near future. But there's a lot of care that's still going to be delivered at distance. And I think, Siobhan made a nice connection there, that sort of technology is a way that we're going to have to try and leverage some of the skilled workforce issues that we are facing. Because, even though it felt like it just descended upon us overnight, I think the underlying elements that have created the staffing issue have actually been boiling for, years. I just think the pandemic and the Great Resignation sort of created the catalyst to cause it to emerge. But I think the underlying issues have been there for a long time. So I could probably ramble on for 2 hours on that, so I better be quiet.
No. We appreciate your contributions, Dave. And again, I think that's an excellent sort of a pivot point for my next question. Is we've been hyper focused on talking about growth and all the cool and exciting things that are happening in healthcare. But as we all know, there are always barriers, and Siobhan mentioned one of them, which is the lack of a skilled workforce. And so it'd be great to hear from you all. What are some of the other barriers to growth that you are currently experiencing and having to get creative to work around? And Elmore, if you want to jump in, we can start with you on that one.
Yeah, the workforce development as well has been something that we've been struggling a little bit. Sometimes we can get leaders, but however, our leaders are retiring. During COVID-19, we talked about a great resignation, and then trying to backfill those leaders and trying to get people who are skilled and qualified to be able to step up into those positions. We did suffer pretty good with nursing services, where we had to deal with a lot of agency and contracts. Those were things that really affected my market. And I think that was a global market that was really affected by that. And how do we overcome those cost barriers? And trying to work and provide good health care without the nurses at the bedside was very difficult. So we've been working on different things and trying to get different services to us. I would think that equipment is always something that we try to get better at, trying to ensure that we can get more equipment, better equipment, because a lot of it is outdated itself, looking into our market and trying to get stronger with that. We're fortunate enough that our buildings are pretty new, but inside the rural market, our infrastructure is something that we always have to look at. And how do we leverage and someone take on that risk of a new building? As the health systems grow, I don't think that we want to be property managers. We don't want to own the property. We want to have the community manage those properties, and pretty much we run the healthcare within them. So those are discussions that we have daily: is how do we expand? What things are barriers for us for growth, and then how can we get better at what we do? Transportation has been something that came to mind a lot of times as well. Looking at how do we get patients from one place to another, even from home to our clinic, and how can we not become a bus company, but how can we support the community with their transportation efforts in the rural areas? So those are things that have been challenges, and we're trying to overcome and assist with, and take on some of that risk as a health system. We take on some of that, and then work with our business partners and work with our community in trying to solidify our medical community.
Thank you. And Siobhan, anything to add there?
No, I think those are great initiatives. I think to Dave's point, this is probably something from a staffing standpoint that's been sitting under the surface, and it is going to take some time to kind of course correct. We recently stood up a community investment fund, and some of that funding is going through building the next pipeline of skilled and trained, medical professionals. So I think the more we as a community of healthcare providers are planning for those into the future, I think the better. Some other barriers right now, I just think the expectations and the lift on a regulatory perspective, compliance perspective, I think there's just a lot asked of healthcare providers right now and health systems. I'm feeling like there's a shift towards sort of a consumer protection or patient protection with things like our price transparency laws and Cures Act. And, they're all great movements, but I'm not seeing the resources that the healthcare systems need to get off the ground on some of these. It's a big lift for our teams. It's a big lift from a technology standpoint. And everybody's sort of left to figure it out on their own. Obviously, reaching out to our outside counsel friends to help us along the way, but it's a big lift, and it comes with significant resource deployment when everybody's got a full-time day job already on their plate. So, I think that's another just overlying concern right now to our teams to get things done.
Great.
Yeah, Rubin, when I think about barriers, so when I was actually in health system C-suites, I used to tease my in-house counsel that their tinfoil antenna were like one of my biggest barriers because of how did you describe it earlier, Siobhan? You're the Department of No or something like that. It's you're not that way, but in-house legal departments can feel like that sometimes. The reality is those attorneys are raising great issues. One of the more interesting barriers we're starting to see for hospitals and health systems is what I would call non-hospital competitors or non-health system competitors, right? So as we are shifting more and more into the ambulatory setting, we're seeing players, whether they are, private equity-backed physician roll-ups, whether they are insurance companies that are acquiring physician groups. Keep in mind the largest health insurer in America is also the largest physician group in America. And they also operate more operating rooms than anybody else. I'm actually working on a really interesting transaction right now. It's a large multi-specialty physician group who is looking for a capital and growth partner. And, they're in a market where there's a large health system that does not employ these folks, but they're affiliated. These physicians drive a lot of volume inside of this health system, and the health system would love to participate in being the capital partner and acquiring that physician group. So we're in a process where we're talking with the health system, but we're also talking with the private equity players that are rolling up, as well as the insurance companies that are acquiring and rolling up physicians in these ambulatory settings. And part of the barrier for the health system is, you've got Stark laws where it can't, you can't appear to be buying referrals in these transactions, and that I'm not an attorney. That's just me playing attorney on a webinar, but that gets in the way of your growth plans when there are other competitors in those processes that don't have those same burdens hanging over the top of them. So,
I want to unpack something a theme that I'm seeing here, and not to pick on Siobhan, but I want to unpack the Department of No a little bit in connection with our conversation about growth strategies. You are in somewhat of an interesting seat in comparison to where Dave has been and where Elmore currently sits. How do you balance the two roles? How are you sort of a good business partner to your client, but also understanding that your primary role is the chief, sort of being the general counsel and providing regulatory legal guidance. How have you managed that role in connection with this explosion and a focus on expansion and growth?
Yeah, no, it's a great question, and it's a tough position sometimes to be in. I think it's finding the balance on, again, what is the end goal? So if I'm meeting with my CEO or my strategic partner, CFO, whoever it might be, and they might use an example like Dave just gave. Well, how come the PE player can come in and hand them $10 million and we can't do that? It's sitting down and sort of explaining, right, the black and white regulatory reasons, but they don't really care about that. And then it's, well, what can we do to get there? How do we make our offer just as lucrative with these other offerings, right? There's many things that we have to be creative about because we are restricted in other ways from a client standpoint, but then we work together to say, what is it that this physician group or whoever the strategic partner is on the other side is looking for, and what can we offer to show that this partnership has real value? So often when I'm working with my business team, it's striking that balance of these are things that are absolute no's, but here are some alternative pathways to get you there, and kind of finding the middle ground on some of those. And there are some areas where you will accept risk, right? Not obviously on Stark Bond, things like that, but there's certainly areas where you are willing to take a little bit more of the risk because there's an area of opportunity that you're going to push on.
Thank you for sharing that. We're getting close to the hour mark, and so I want to get one more question in and then reserve some time to get any Q&A from our audience, and then squeeze in some closing remarks before we're out of time. One of the things that we've talked about quite a bit is growth through acquisition, but we also talked a little bit about how hospitals and health systems are also starting to look at some alternative affiliation mechanisms. And I think that's what's at the heart of some of this is just this difficulty of integration on the back end when you think more traditional merger acquisition. And so would love to hear from this group some of the things that they've done from an integration standpoint to make these types of acquisitions a little bit more palatable to both leadership and the legal teams. And happy to, Elmore, I'm not sure how much from an acquisition standpoint you guys have done, but happy to hear your thoughts on it. If not, Dave, I'll let you jump in.
Mm-hmm.
Dave, you want to?
Oh, go ahead.
Go ahead, Siobhan.
Yeah, I guess this is a huge area of focus for us right now, coming together and through merger, right? So I think a big piece of this is understanding the culture. And is there a culture defined and strong on both sides, or are you coming up with a new defined culture of the merged or new system together? And it's as simple as putting your values, your vision, your mission statement back on the table and having key participants across your organization come and help define what that's going to be. It's your branding strategy. It's all the things that make people feel like you're part of the process to gain systemness. Obviously, in the background, you're aligning policies, you're coming up with common leaders, you're coming up with, decision-making processes. So there's achieving all of those systemness checklist, if you will. But I think on the outward facing, it's removing your home jersey and coming up with a team jersey that's your go forward position. I think that really makes for success, and having those communication streams open and transparent up front, I think has helped us a lot along the way.
Yeah, I was going to say, totally agree. And communicate. It may feel like, gee, I've said this message 50 times today. Just, you got to remember, the person that's hearing you probably is only hearing it for the first time, or maybe the second time. So you almost can't over communicate. You just have to keep the communication channels open. So.
Right. Well, I appreciate all of your thoughts on the questions that we've run through so far. We've got one question from our audience that I'll drop in the group chat. I'm not sure if you can see it or not, but the gist of the question was, given some of the challenges in 2022 for health systems, from inflation, contract labor, et cetera, do you expect to see accelerated consolidation either through M&A activity for hospitals that are for some of the systems that are out there struggling, at least from financially or from a resource standpoint?
So how about I take a first crack at it and everybody else can pile on. I definitely think we're going to see more consolidation. We've seen a fair amount of it over the course of the last several years. Always keep in mind, when you read some of the headlines in some of the, the newsletters and things that go out that speak to, healthcare, M&A deals down 20% in the third quarter compared to the third quarter of the year before. There's traditionally been about 100 deals a year. So, down, it only takes a couple of deals one way or the other to make it go up a lot or down a lot from a percentage perspective. Always keep that in mind. And we are starting to see more and more deals of bigger and bigger systems coming together, right? So this isn't just the $4 billion system picking up the $150 million community hospital 30 minutes down the road. These are the $4 billion system and the $4 billion system coming together to make an $8 billion system. And interestingly, many of those are reasonably strong players on each side of the transaction. So we're starting to move into strong players being opportunistic with other strong players, as opposed to strong players just picking up the struggling and the weaker participants.
Yeah, I would agree. I think there's going to be a continued path here. I think with any change of administration, there's always a little test the water to see where the FTC's temperature is, and this administration came out strong. But I think we've seen that activity pick up again, and people that have the appetite for it are certainly diving in. So I think the trend will continue.
Yeah, I agree. Listen, Siobhan, that's a great point on the regulatory angle. We're definitely seeing more of that. It's the head of the FTC she's an interesting player, right? She's more of an academic than, say, a practicing attorney. I don't mean that in a negative way, but I just mean it's a different perspective to look at some of these things. There's been a fair amount of saber rattling, particularly on, vertical integration and things like that. When push comes to shove, a lot of it gets back to, what do the laws say? What does the precedent case activity demonstrate? I think some of the saber rattling will lead to as much of just longer timeframes to get deals done, and probably larger legal bills to get deals done, but that you can still get to finish lines on a lot of deals, I think.
Well, I again appreciate all of your excellent contributions to this conversation. This has been fun. It's been great. and just want to give each of you an opportunity with the 4 or 5 minutes that we have left. If you have any closing remarks you want to share with our audiences about healthcare generally, about growth, would love to get those in now, and we'll start with Siobhan. Go for it if you've got anything else that you just want to leave as sort of key takeaways from our conversation today.
Sure. No, thank you again for the opportunity. I would say just as a key takeaway, it's been, particularly during COVID, very refreshing to be able to reach out and network on some of these problem solving and similar experiences that we're experiencing, whether it's staffing issues or things that, that where antitrust antennas don't go up, not in that way, but just having common resources and trade organizations, our local hospital association, or whatever it is that's in your neck of the woods. I really encourage others to take advantage of that, because I'm not sure we had as much of it pre-COVID, but I've found those resources to really be helpful when you're working through just sticky situations that everybody's dealing with but hasn't kind of surfaced. So just kind of some lasting words, but thank you so much for having me today.
Thank you for participating. Dave?
I guess my final words are, I think growth is going to become even more important going forward in the future. Scale, consolidation is going to happen. And this may sound a little self-serving for some of the folks on the call, but these are complicated deals. They're complicated transactions, and make sure you're using good advisors, good legal advisors, good financial advisors to help put these things together, because these transactions are some of the biggest transactions in the history of your organizations, right? This is no time to practice, right? You got to get it right. So.
All right. Thanks, Dave. I really appreciate your willingness to participate. Elmore, bring us home.
Yeah, so definitely it's been a pleasure to be here. And what we're really looking at moving forward is really not a competition, but looking at the collaboration of our medical community and trying to build stronger medical community. And that's either at the $4 billion facility mark or at the local community hospital piece. We want to make sure that we're strong and that we have a relevant health system in all the communities that we serve. And I think that COVID-19 brought us together a little bit closer. The physicians that are staff and the physicians that are community providers, we were able to collaborate, get together, take care of those patients, and move forward and build a better health system in small communities and in large urban communities. And I think that we're going to continue doing that through collaboration, through different programs, and looking at value-based care and in community health services. And I'm very excited about how we're going to move forward in our health communities in the United States.
Thank you, Elmore. Thank you again to each of you for your time today. I learned a lot and really enjoyed the conversation. Thank you to our audience for tuning in, and this was great. Looking forward to doing it again and to seeing some of the exciting things that your respective organizations are doing out in the marketplace.
Very good. Thanks for having us.